my name is Lara Freidline, and I'm a physical therapist at Oxford Physical Therapy. I have worked in the aquatic program here for 10 years. I did not grow up doing water things. Actually, I grew up in New Mexico, and I didn't start swimming a lot until college. But I have learned a lot about the pool and the benefits, especially for physical therapy, that I do want to share with you just a little bit. So, I'm going to use a helper. Lauren, come on over. Water that really make it beneficial for injuries, or soreness, or difficulty moving, not being able to fully weight bear. And we'll start out with buoyancy. So, we're going to let Lauren float a little bit. This is a neck cushion that we use quite a bit. This procedure I use is just a floating in the water. And I call it snaking because you do snake the body through the water and let it relax. And then I can also pull her and get a little gentle traction too. Her body is floating, which is using that principle of buoyancy. It's also very relaxing in the water. People will relax a lot easier in the water than they can on land. Some of these things, especially the spine, the neck, a lot of systemic conditions. And raise your arms up, Lauren, and take a deep breath. And then breathe it out. Good. And bring your arms up. Good stretch, and breathe it out. Good. And relax. Buoyancy, you're in the water and you're walking at waist deep water. So if you were standing here, you would feel about 50% of your body weight. If you were walking where the water was about neck deep, you would feel about 10% of your body weight. So that is one of the neat things about the buoyancy property of water, and we use in therapy quite a bit. The second property that we'll talk about that's beneficial for therapy is resistive forces and viscosity. So water has about 12 times the resistance than air does. So when you move in the water, you have to push against all of that mass of water. And it can be very beneficial for therapy and for strengthening. And there's a couple things we can do to make it harder or easier in the water. So Lauren is going to demonstrate some internal and external rotation exercises for her shoulder. We use these a lot for rotator cuff injuries. And she's just bringing it in and out. And she is using, I'll demonstrate here, you can see this is the paddle. You can change the resistance with this by making it more surface area here. And as we do that, she's going to have to work a little bit harder. Good, back and forth. Now, if she goes slow, it's easier. If she goes faster, go a little faster. It's a lot more resistance and it's a lot harder to do. So I can do the same exercise for somebody who's just recent out of surgery or for somebody who's really needing to get a lot more strength out of this, and she can do it in the same pool with the same tools, just based upon how she increases her speed or increases the surface area of the resistance. The third property of water we'll talk about is hydrostatic pressure. Hydrostatic pressure is equal pressure on a matter that is put into water. So there is equal pressure on your leg, and it helps with swelling. It does it on its own. We don't have to do anything special. That's one of the wonderful benefits of being in the pool. I've had patients that have ankle swelling that will go down a ½ inch after walking and moving in the water, as opposed to doing exercises on land where the swelling will go up at the end of a therapy visit. So we're going to have Lauren just demonstrate something that I use for most patients to get them moving and walking in the water. She can walk forward, and then she'll stop, and then walk backwards. And then forward. And then sideways. And back the other way. I just wanted to thank you for listening here and learning some about aquatic physical therapy. And if you have any other questions or you want to learn more about it, you can contact one of our physical therapy clinics. We have 5 different locations that do offer aquatic physical therapy at Oxford Physical Therapy. Thank you.